Let's talk about ventilators. For NCLEX, you'll be tested on high pressure alarms and low pressure alarms. When the question is about high pressure alarms, think about obstruction to the flow of air into the patient. And so, what are some of the things that can cause this alarm to set off? One of them is when the patient is biting on the tubing. It causes the resistance to the flow of air. And when that happens, you think about if the patient is unconscious, think about probably the person might be in pain. So in this case, your intervention is pain control. Another thing is if they are alert, you just tap them and say, "Hey, buddy, stop biting on the top on the tubing." But if they are unconscious, think about pain. Next is going to be kink. When there's kink, all you have to do is unkink it. When there's water in the tubing, empty the water. And when you have secretions that are very thick, all you have to need is you need to suction them. Before suctioning, you might have turned them to their side, or you might have tried coughing. If that doesn't work, before you suction them. But of course, when they are unconscious, you don't have to turn them, you have to suction them. The next is going to be coughing. When the person is coughing, it also causes the high pressure alarms to go off. And in this case, you don't do anything, you just observe them. That's why sometimes we give them mucolytics to help things the secretions. Cough suppressants are not good. As far as the person is producing secretions, you stay away from cough suppressants like codeine or benzodiazepines. In this case, we talk about Tessalon pills. Pneumothorax. When air enters into the pleural space, that's what we call pneumothorax. When that happens, think about chest tubes. I'll be talking about chest tubes very soon. So, knowing the cause and then also the interventions will help you answer the questions right when it comes to the angles. Next, let's look at what causes the low pressure alarms. When the low pressure alarms is mentioned in question, think about air leaks or when there's a decrease when there's a decrease in the resistance to the flow of air. That is what you should be thinking about. Sometimes when the tube gets disconnected, it can also cause gas. And then when there is a half leak, it can also cause that. Finally, when there's an extubation, it can cause the low pressure alarms to go off. What do you do in this case? All you have to do is to reconnect the tubing or check the calf pressure. When you cannot find what is causing these alarms to go off, please look for options that says that manually ventilate the patient. In this case, you'll be using the ambu bar. One thing you have to remember is that always assess your patient, not the machine.